Do joint pain supplements actually work, or are they a waste of your money? Many people spend hundreds of dollars on pills that are not effective. I'm Dr. Sonam, an interventional sport medicine doctor, and today I'm going to break down the top 5 supplements that have real evidence behind them. Stay tuned till the end because number 5 is the one I recommend the most often to my patients. Number 1 is Boswellia. It is one that you may not have heard of, but it's actually an up-and-coming natural treatment for the symptoms of osteoarthritis. It is commonly used in traditional medicine for its anti-inflammatory effects and GI disorders, and is also known as Indian frankincense. So how does the supplement work? It essentially inhibits inflammatory molecules in the body, including CRP, TNF-alpha, 5-lipoxygenase, and MMP. These agents are known to play a role in cartilage degradation and the progression of osteoarthritis. So the hope is by inhibiting these supplements, we can potentially slow down the progression of the disease and treat the symptoms. What are the main benefits of this medication? In recent studies, Boswellia has been shown to reduce pain, stiffness, and increased physical function in those with osteoarthritis when compared to those taking the placebo. It is important to note that the quality of the evidence is limited. What are the main risks of Boswellia? Overall, it is a very safe supplement with minimal downside, minimal side effect profile, and minimal drug interactions. At most, patients in some studies reported some headache, dizziness, and nausea. However, it is overall very well tolerated. The recommended dosing for this medication is approximately 100 to 250 milligrams, taken daily for approximately 3 months before you start seeing benefits. Overall, while there is limited evidence, it is promising, has a very low risk profile, and is worth a try in those suffering from joint pain and osteoarthritis. Number 2 is glucosamine and chondroitin. This is the classic duo that most people with arthritis are currently taking. Glucosamine and chondroitin are molecules that make up the substance of cartilage and synovial fluid, and they are seen in high concentrations in the joints. How do they work? Glucosamine has an anti-inflammatory effect on the body by down-regulating pro-inflammatory molecules that are known to further destroy cartilage, like interleukin-1. Chondroitin is hydrophilic and draws water into the cells, which helps with the mechanical support and hydration of the joints. It also helps chondrocytes, which are the cells that make cartilage, regenerate more effectively and slow down the progression of cell death. Lastly, chondroitin is seen to have anti-inflammatory properties by inhibiting pro-inflammatory molecules in the body. These molecules include IL-1 and prostaglandins. Overall, glucosamine and chondroitin do have several meta-analyses and randomized controlled trials that show improvement in pain and function in those with osteoarthritis. While both supplements are commonly sold together, there is actually some debate as to whether or not they work better together than separately. In many studies, chondroitin itself can be very effective in reducing the symptoms of osteoarthritis. What are the risks of glucosamine and chondroitin? Overall, they have a very favorable side effect profile, and both have mild GI side effects, which are nausea, vomiting, and diarrhea if taken at high doses. What are the recommended dosings of these medications? For chondroitin, it is recommended that this be dosed at 800 to 1200 milligrams a day in 3 divided doses, whereas for glucosamine, it is recommended that it is dosed at 1500 milligrams a day in 3 divided doses. For both of these medications, it is advised to take them at least 8 to 12 weeks before you start to see benefits. My final take is this is a definite maybe. The people who take it swear by it. I just encourage all of my patients, if they are to try this, give it 2 to 3 months before you evaluate whether or not it works for you. Number 3, collagen peptides. Now, this is becoming increasingly popular in those with arthritis, but as well as athletes as well. It has a variety of benefits, not limited to joints, but also skin, hair, nails, and so forth. Newer studies support that it can actually help support joint function. Collagen is a protein that is found in a variety of tissues in our body, but mainly also in our tendons, ligaments, and joints. The most common sources are bovine, marine, and porcine collagen. Our body makes 4 different types of collagen, type 1, 2, 3, and 4. For the purposes of those dealing with joint pain, type 2 collagen is the one that makes up joints and cartilage. Collagen comes in 2 main forms: hydrolyzed collagen, where they break down the individual products of the collagen and give you all 4 types, and unhydrolyzed type 2 collagen. Collagen peptides provide the body with proteins it needs to repair cartilage, bone, and skin. A meta-analysis from 2025 showed that those taking collagen supplements improved their symptoms of osteoarthritis, decreased pain, decreased stiffness, and increased function. However, it is important to note that the evidence currently is low quality. One of the secondary benefits from taking collagen is you will also see better skin and better bone health with supplementation. What are the main risks of collagen peptides? There are some GI side effects that can be seen in those taking really high doses: diarrhea, abdominal pain, and indigestion. However, they are relatively well tolerated. At really high doses of greater than 10 grams a day, it will also increase your urinary oxalate levels. So for those who are prone to kidney stones, either have a personal history or family history, the risk of getting kidney stones may increase. So definitely speak with your physician prior to supplementing with collagen if you do have a history of kidney stones. The recommended dosing for collagen is approximately 10 grams a day. This comes in a powder form. Although evidence is limited, it is generally well tolerated and will help both hair, skin, bones, and joints. So it's something I'm open to recommending for many of my patients. Number 4, omega-3 fatty acids, also known as fish oil. Fish oil is a very popular recommendation I will make in my patient population, as it helps both joint health and heart health. And the good news is the evidence for fish oil is stronger than most supplements. More specifically, omega-3s will decrease the level of pro-inflammatory molecules like interleukin-1, TNF-alpha, and also cartilage-degrading enzymes, while increasing the anti-inflammatory molecules in our body. The main benefits of fish oil are not only limited to a reduction in joint pain and inflammation, but can also be seen to help with mood disorders, mainly depression, as well as heart health and healthy fat or lipid profiles. Both high and low doses of fish oil have been shown to improve pain and function compared to baseline in those taking it with osteoarthritis. The main side effect of fish oil is the gastrointestinal effects, so fishy burps, nausea, vomiting, heartburn, and diarrhea. The second most common risk that you have to consider is that fish oil technically has antiplatelet effects. So for those taking blood thinning medications, it can actually increase your risk of bleeding. So if you're on blood thinners, talk with your doctor before you consider starting omega-3 supplementation. For those with osteoarthritis, it is recommended to take 1,000 to 4,000 milligrams of EPA and DHA combined daily. Now remember, you will have to take it for about 2 to 3 months before you start seeing full benefits. My final take is yes, this is a medication that has widespread benefits in addition to helping with joint pain and metabolic health. Now, for those with severe cardiac issues or heart issues and who are taking blood thinning agents, I would encourage you to speak with your doctor before starting this supplementation. And number 5, finally, my most recommended supplement, turmeric and curcumin. I'm going to use the names turmeric and curcumin interchangeably, but curcumin is the active ingredient extracted from turmeric. Now, turmeric is one of the most well-studied anti-inflammatory supplements on the market. It has been used in traditional medicine for a very long time to treat the symptoms of osteoarthritis. Turmeric is a polyphenol with anti-inflammatory properties, and it increases the amount of antioxidants, good molecules that the body produces. Current evidence supplementing with curcumin shows moderate to large improvements in those suffering from osteoarthritis in relation to pain and function. Many randomized control trials actually show that curcumin can be as effective as non-steroidal anti-inflammatories when treating the symptoms of osteoarthritis by decreasing pain and improving function. I personally find it amazing that curcumin and anti-inflammatories can have a similar effect in treating the symptoms of osteoarthritis, with one having less side effects. Curcumin has also shown benefit in those with inflammatory arthritis like rheumatoid arthritis. In addition to the benefits in the joint, some patients actually note improvements in their blood lipids, improvements in weight loss, and improvements in sugar or glycemic control while supplementing with turmeric. What are the main risks of curcumin? At doses of greater than 8 grams, you can see things like yellow stool, nausea, vomiting, headaches, skin rashes, and liver function abnormalities. The second thing you have to be mindful of is curcumin has antiplatelet effects. So if you are on blood thinners, you can increase your risk of bleeding if you are supplementing additionally with curcumin. So for anyone taking blood thinning medication, I encourage you to speak with your doctor before starting supplementation with turmeric. Recommended dosing is 500 milligrams 3 times a day. It is recommended to take turmeric with black pepper extract to increase the absorption of the supplement. My final take, definite yes. Very safe and quite an effective supplement to take to treat the symptoms of osteoarthritis. Just make sure you check with your doctor to ensure that there are no interactions with other medications that you take. Now, don't get me wrong, no supplement replaces proper diagnosis, rehab, or medical treatment. However, these 5 tend to have the most evidence compared to the other hundreds of supplements marketed out there. If supplements alone are not helping, you may be a candidate to consider cortisone, PRP, or hyaluronic acid injections. I speak with them about my other videos that I will link down in the description. If you want to read the studies yourself, I used examine.com for these summaries, and I will put my affiliate link down below. If you want access to patient handouts, post-injection care guides, and supplement guides, these will be on my Patreon, and any support will help me continue to create free evidence-based content for this channel. If you found this information helpful, like and subscribe, as well as share this video with someone else who's dealing with joint pain. For now, that's all.